I just realized I'm muted. Good morning, good morning, good morning. Welcome back if you have joined us for other events here for Expo Week. We're happy to see you. This topic that we're covering today is near and dear to my heart. It's about seniors and caregivers. I have been a caregiver of my parents for the last 11, maybe 12 years. So cared for my father for 5 years, leading up to when he passed away. And the last 4 months, they sent him home for hospice care. Now, for me, hospice in the movies, you're there, you're able to just spend time with your loved one, um, prepare for what you know is coming, and you're just by their bedside, relaxing and sharing stories. But in reality, the hospice situation, for most people, if you're not wealthy, there is no round the clock nurse that's there to care for your loved ones so you can just spend time with them. You are the caregiver 24 hours a day. So we may talk about that a little bit later. But I first want to take a moment to thank our founder, Rhonda D. Robinson, for all of her hard work with Ohio Black Expo past and present. She was inspired to start the expo back in 1980 after organizing with the Columbus Black Convention. She managed all of the vendors, and the vendors were just so happy to have that exposure. She felt we need to make this happen more frequently. So she started the Columbus Black Expo in 1980. It ran for 7 years at the focal point of Mount Vernon Plaza here in Columbus, Ohio. And she realized over the years and as it grew that people were coming from all over not only all over the state, but also other places, New York, Chicago. So she called it the Ohio Black Expo starting in 1988, had to move it downtown because it outgrew the space that it was in. And it ran for another 3 years in Columbus, downtown, and then went to Dayton and then Cincinnati. So we were just scheduled to bring it back last year. We were going to have a downtown festival on the riverfront, and then COVID hit. So we had to quickly pivot to virtual. And this year we're pivoting again to virtual, but we're excited about being back downtown on the riverfront next year. So please make sure you save the date. The Riverfront Festival, Cultural Festival, will be on May 28th and 29th, which is just like this weekend, the weekend leading into Memorial Day. But we will have events such as this leading up to the festival on the weekend. So just stay tuned to our website. If you registered for this event, you are already subscribed, and we will let you know as those plans for next year develop. Um, so again, just thanking our founder, Rhonda D. Robinson, for all of her hard work. I've been working on this expo now for probably about 4 or 5 years. I cannot imagine the amount of work that goes into pulling off a large scale event when you have no email, no internet, no texting, no social media to promote. All of the tools that we have today were not available when the expo took place before. So I just really appreciate everything that she had to do to make the expo as great as it was in the past. So we're bringing it back in grand fashion. Um, so again, on this topic today of seniors and caregivers, I think for me personally, going back to childhood, I've always had a deep appreciation and respect for our elders, and that was taught to me by my parents and my grandparents. And so, just that appreciation for their wisdom and then also respecting and wanting to care for them when they need help. So I've spent my entire life feeling that way. So when my parents began to age and needed my assistance, it wasn't a struggle for me mentally or emotionally to say, oh my gosh, now I have to care for my parents. I just felt it was just natural for me. That doesn't mean it's easy. It just means it was natural for me. And for a lot of people that end up having to care for their parents or other loved ones who are seniors, it can be a real struggle. And I know it's a real struggle because it is a struggle for me, even though I have so much love and appreciation for my parents, my father before he passed, and now caring for my mother. She had a terrible car accident years ago and was just so dedicated to her work that she never slowed down to get surgery or address it. And so just 5 years ago, I don't want to tell my mother's age, she'll be mad at me, but just 5 years ago, she had two spinal surgeries. It was they almost rebuilt her spine, but the damage was already done and so great that she's still in a wheelchair, really doesn't have much control over her gait and enough strength to walk. She can sometimes walk with assistance. We try to just walk with her. She has some other complications with her shoulders, so she really can't even use a walker. Um, but now we're, the topic that we're dealing with today, the memory loss epidemic, that's also affecting her. And so it's a lot as a caregiver, um, and it's a lot, obviously, for the loved ones that we're caring for, to, as a senior, to start to accept that you don't have, you can't just up and go like you used to. In your mind, you're still thinking, oh, you see something on television, I want to do that. But your body is not not necessarily allowing you to. So it's a lot to accept that, and and to have to give in to being cared for by your children or your loved ones. Um, so it can be a challenging time in life. And the biggest piece of advice that I have for any of you who are new caregivers and trying to navigate through it and figure it out, because like I said, I've been at it for about 12 years now, is really to try to find balance, which also is not necessarily easy. I'm blessed to be able to work from home. I work for myself. And so I have a lot more control over my schedule than a lot of people do. It has to be a real struggle if you're working a 9 to 5 and trying to navigate through how to care for your loved ones. Maybe you have to take them to an adult daycare, um, and then try to pick them up at the end of the day and get home, and dinner and everything that goes on with that. So, I think it's really important to look for help, see what resources are available. And even for me, over a decade in, I'm still always looking for resources and help and trying to figure out what's best. Here in Ohio, the Department of Aging really does it is a good starting point if you're not plugged into your local office on aging or agency for aging in your county or your city. So if you're here in Ohio, you can go to aging.ohio.gov. That's aging.ohio.gov. And there, whether you're a senior or a caregiver, again, it's a good place to start. You can find services in your area. You can learn about the Golden Buckeye Card, which is available to anyone who's 60 years or older, or if you're under the age of 60, if you're 18 to 59, you can still get a Golden Buckeye Card if you have a disability. Um, and so you can learn more about services. You can find providers and services, again, in your area on that website. So it's a good place to start. Also, I was excited to see recently AARP has been doing a campaign, I believe, since April, for their new the caregiving part of their website. And I was excited to see that, because I really don't see a whole lot focused on caregivers, and this entire website is geared towards caregivers. So I've kind of been looking through it and have seen some articles. For example, there's one, 7 tips for avoiding caregiver burnout, that really work. And I'll just really quickly go through them. Remind yourself that your work has value. So, whatever you do is worthwhile. And for me, that's the work that I do in my career, as well as the work that I do for my mother. I see this time as not, oh, I have to put my life on hold for her. I mean, she did the same thing for me in raising me as a child. So I feel like I'm paying her back, and I tease her all the time. She feels guilty, but I've been caring for her for full time for about 5 or 6 years, but she gave me 18 plus years. So I still owe her. Um, Find ways to mass communicate. Um, I have text threads with different parts of my family, because they always want to check on her. And when my father was alive, same thing. And so you can get really it can be really exhausting if you're having to one by one give updates to everyone. So create a mass text group, or email group, with family and close friends that you want to update. So you're not having to have all these individual conversations on updates. Join a support group. This is a huge tip. I'm so excited today that we'll have the Alzheimer's Association with us. They'll be starting their presentation shortly. But I joined a support group about 2 months ago, and I will say, I will admit, it changed my life. It's really helping because I felt like what I was dealing with, I was alone in that. But just being on the support group call that first time, and it's remote right now on Zoom, but that first time, I was able to hear that others are experiencing exactly what I am, and get tips. Oh, this is how I do it, and that works for me. And I've tried those things, and it is helping. So definitely join a support group, not only for support to make you feel better and give you strength, but also to share tips and resources. Get organized. That's important. I have so much going on that if I don't use my calendar, if I don't have a to-do list, stuff falls by the wayside. So use technology if you can. Use a a calendar, or even if you have to write it down. But just be really organized so you don't miss anything. Nurture the positive relationships in your life. You may be overwhelmed, but take time to talk with friends and family you're closest to. That's a really, really important tip for me. Even before COVID, I kind of became a hermit because I'm not really able to leave my mom. And so I order my groceries online. Again, I was doing that pre COVID, and I find that I'm here. I don't really take a lot of time to talk to friends. I have an amazing husband, and so he's like my best friend. But my girlfriends, I really don't talk to them that much, and a lot of other family members I don't keep in touch the way I should. But when I do, it's so wonderful. So make sure that you do that. Give yourself a break. You can't keep going 24/7. And kind of that analogy that you get when they're describing on the plane how to make sure that everyone's safe. You put your gas mask on first so that you can help the person that's with you that needs assistance. You really have to do that. That's a real struggle for me to put myself first sometimes, but I realize if I'm not okay, then she's not going to be okay. So take time to find a way to give yourself a break and to just do the things that you enjoy that kind of give you peace. And then don't forget to take care of your own health. On that same tip, I have my own health challenges, and I've made it more of a priority recently because I know that, again, if I get sick, if I end up in the hospital, who's going to care for my mother? So it's really important that we do that. So again, we have the Alzheimer's Association here with us today. They're going to do a couple of presentations. The first, I believe, is on how to identify when you or a loved one might be dealing with uh, Alzheimer's or dementia. And then they're going to follow that up with how to care for someone who is dealing with Alzheimer's or dementia. So a lot of great information is coming our way. And then later on, I'll be having a conversation with another person who cared for her mother for years, and we're just kind of going to kind of talk and share tips and resources, things that we've learned. And she's a senior herself. I hope she doesn't mind me saying that. She looks amazing, but she will be on a little bit later on in the 10 o'clock hour. So without further ado, I would like to introduce to you Pamela Myers. Pamela serves as the program director for the Alzheimer's Association Northwest and Central Ohio chapters. She assumed the Central Ohio chapter's program responsibilities in March 2020. She is an RN with an extensive healthcare and wellness background, providing acute and community care for 17 years and serving as executive director for a community speech and hearing clinic for 14 years. She took on this program position at the Alzheimer's Association because she wants to see a cure for this disease in her lifetime. In her role, she oversees all the different programmatic activities of both of her chapters. Good morning, Pamela.
Hi, good morning. I'm so happy to be here. Hope you're doing well, Sherry.
I am. I'm looking at this weather. I'm like, oh. But we need the rain, right? If without the rain, we can't appreciate the sunshine.
Well, I think I shared with you, I live outside of Toledo. So just so you know, it's raining up here too.
Oh, good. We're not the only ones down here in
You
Columbus.
are not. You are not.
Well, thank you so much. I see that you have someone with you. Do you want me to? I don't think the camera's on. So are they coming on later?
Yes, yes.
Okay.
She is coming on later. I'm going to present first, and then
Okay.
Deneen will come on. Yes. So,
Okay. All
well,
right.
thank you so much for having us today. We're so happy to be here. And Sherry, thank you for sharing your story. I think one of the things that we notice in working with our families at the Alzheimer's Association is how important that sharing with others and learning from others who are on the same journey and path that you are. So thank you for sharing that with us. And your tips for caregivers was absolutely awesome. So many of those things we also share with our families. So thank you for
I
sharing.
have to credit AARP for that. I was reading it off the website, but they are amazing tips.
Yes.
And I just want to reiterate why I felt it was so important. I started trying to hunt you guys down a couple of months ago, and I was adamant. I knew that we needed to speak with you on this topic. I definitely view the Alzheimer's Association as, the authority in the United States for Alzheimer's and dementia. And I know you're going to speak about this, but you had a study that showed, and there have been other studies, by the CDC, just showing that these diseases affect the Black community at double the rate of the white community, and still even just a higher rate than any other group.
Yes.
So for us with Ohio Black Expo, it's crucial for us that we really dive into that, not just today in this workshop, but we really want to have ongoing work in this area for awareness and just whatever we can do to help lessen the impact of this. So thank you again for being here. I'll let you go ahead and take over. And I'll be here if you need me. I'll be here for support, and I'll be monitoring the questions.
Great. Thank you, Sherry. Thank you so much. And again, we just want to thank the Ohio Black Expo for having us here this morning. We really appreciate the opportunity. Our number one mission on the program team is outreach and just helping people get connected to resources, education, learning about the disease, learning what that journey is going to look like. So we're just so happy to be here today. So I know from Sherry that some of you that are on the webinar today may be caregiving for a loved family member, and some of you may just be exploring because you have some concerns that maybe there's someone in your life that is having some memory or thinking issues. So what I thought we would do today is to take an abbreviated version of two of our Common Core programs that are normally an hour. We're going to shorten those for you today. The first one is going to be on the 10 warning signs of Alzheimer's. I'm going to do that one. And then I'm so happy to have with me today Deneen Day. Deneen is one of our longtime Alzheimer's Association volunteers and community educator, and she's also been a primary caregiver. So she's going to talk about some effective communication strategies and some tips that you can use as you're caregiving in communicating with your loved one. So we're just so happy to have her with us today too. And then we'll have time, I think, before we sign off, just to answer any questions that you have or share some more additional resources with you. As Sherry said, she's been attending one of our Alzheimer's Association caregiver support groups, and she's found that immensely helpful. I'm also here to tell you that we have been virtual since March of 2020, and we're very happy that we are going to be, as the health restrictions are lifted, we're going to be moving our support groups, our education programs like this, and our early stage activities that we do actually for people living with dementia in the early stage. We're going to be moving those activities back to in-person a little bit slowly, depending on the venue, but over the summer, so that by fall, we hope to have everything back up and running and open. So I'm very excited about that. So I'm going to share my screen with you. I do have a little bit of a slide presentation to show along with the 10 warning signs of Alzheimer's. So again, this program is for you if you just want to learn more about the warning signs of Alzheimer's or other dementias. And maybe you've noticed memory or thinking changes in loved ones or close friends, family. So one of the things that we always get questions about when we're out speaking is there a difference between Alzheimer's and dementia? So we're just going to look at a few short video clips here before we get into...
Dementia is the umbrella term for an individual's changes in memory, thinking, or reasoning. There are many possible causes of dementia, and Alzheimer's is the most common cause. Other causes of dementia are vascular dementia, which is marked by changes in the blood flow and the blood vessels in the brain. Dementia with Lewy bodies, identified by specific brain changes throughout the brain that include the buildup of a protein known as alpha-synuclein. And frontal temporal dementia, which is marked by brain cell loss in the front sections of the brain or the frontal lobe. Each type of dementia may have distinct characteristics to cause specific behaviors in the individual, but there is also some overlap in behaviors among the types of dementia.
More than 100 years ago, Dr. Alice Alzheimer's described specific changes in the brain, what we call the formation of plaques and tangles. Now, Alzheimer's is a progressive brain disease that's marked by these key changes and is thought to impact memory, thinking, and behavior. The brain has three main parts: the cerebrum, the cerebellum, and the brainstem. Each one plays a role in how the body functions. The cerebrum fills up most of your skull. It is part of the brain most involved in remembering, problem solving, thinking, and even feelings. There are about 100 billion nerve cells or neurons throughout the brain that transmit messages in order for us to create memories, feelings, and thoughts. Alzheimer's disease causes nerve cells to die, which leads to the brain tissue loss, or what we call shrinkage, and causes loss of function and communication between cells. These changes can cause the symptoms of Alzheimer's disease, such as memory loss, problems with thinking, planning, behavioral issues, and even at the end stages, problems with swallowing.
It's important to know what the warning signs of Alzheimer's are and to be on the lookout. We know that we change over time, and the warning signs of Alzheimer's can be warning signs of a number of things. But when you see those in yourself or in someone you care about, it's important to check it out, to consult with a doctor, to find out what you're dealing with.
So as Ruth said, it's important to know what the warning signs are and to be on the lookout for these changes. So the Alzheimer's Association, as a leader in this area, we developed a list of 10 warning signs to help people understand the difference between normal aging and the signs of Alzheimer's and other dementias. So we're going to go through these one by one so we can see these. Whoops, sorry. Going to go back a slide here and start over. The first one is memory loss that disrupts daily life. So we're going to look at that. So what are some possible signs of dementia in this case? So one of the things that we notice folks that are on this journey is that they forget recently learned information. They can forget important dates or events such as birthdays, wedding anniversaries, things like that. They may ask the same question over and over, which we know can be very trying for our caregivers. And they increasingly rely on memory aids. We have families who will take those little Post-it notes, those sticky notes, and they'll place them over different cupboards in the kitchen, or maybe a sign on the bathroom mirror to remember to brush your teeth. So we see those changes in our folks that may be having dementia. Typical age-related changes, sometimes, people forget names or appointments, but we will typically remember those later on. And unfortunately, folks who may be having the mild cognitive impairment or early dementia, they're not able to remember those things. Sign number 2, some people may experience changes in their ability to develop and follow a plan or work with numbers. So we notice when families come in for care consultation and we're working with them, that one of the first things that perhaps the spouse or the kids notice is that mom or dad can't balance their checkbook anymore. And, they've been folks that have, always balanced their checkbook to the penny, but they're not able to do that. Or another thing we hear is that someone will pay their same monthly bill 2 or 3 times because they forgot that they paid it already. And sometimes it's just harder for folks to concentrate, and things that used to come easy to them become harder and harder. And for typical age-related change, sometimes we make mistakes, but we are able to catch ourselves, we make the corrections. But again, those with dementia typically do not have that ability to do that. Sign number 3, difficulty completing familiar tasks. So just sometimes folks have difficulty with driving, organizing a grocery list, remembering the rules, anything that's a process. So think about all the things that you do in your day that you have to process from step 1 to step 2. Sometimes our folks with dementia, they aren't able to do that. And so, sometimes in a typical age-related change, we might need help learning how to, they say here, the settings on a microwave or to record a television show. Sometimes we might forget, how to get on social media and post something on Facebook, something like that. But we can work through that, whereas it is much more difficult with a person who has possible dementia. Confusion with time or place. We get this from families a lot too, that folks will ask them, when are we going somewhere? What time are we leaving? And so you say, well, we're going to be leaving at 2. And then a few minutes later, they ask, again, like before, they're asking that same question. But they have the inability to understand what leaving at 2 o'clock actually means. Sometimes we'll have families that share with us that, many, many folks who have mild cognitive impairment or who are living in the early stage of Alzheimer's, they're still driving, they're still working, but they may drive somewhere, end up somewhere, and they're not sure how they got there or why they were trying to get there. And for those of us who are just typically age relating, sometimes we get confused about things, but again, we're able to figure it out. Sign 5, trouble understanding visual images and spatial relationship. Sometimes folks who are in the early stage are having vision problems. So our vision is very important with balance. Folks living with dementia will describe that they sometimes have more like tunnel vision, that they're losing that ability for peripheral vision. So they'll have difficulty with balance. They may stumble, whereas that's something new for them. A lot of times folks have trouble reading. And so it's not so much that they don't read, that they can't read any longer, but they may turn the page and they may not remember what they read the page before, which is very hard. And again, with that vision change, they may have trouble judging distance and determining color or contrast, and of course then have issues with driving. And the vision is because they're not necessarily that they're losing their vision as we would think of it, but it's because of the changes that are happening in their brain with the disease. And for a typical age-related change with vision, a lot of folks may develop cataracts, which is treatable. Sign 6, new problems with words or speaking or writing. And so a lot of times you'll talk to families and they will say, mom will, she'll be talking and then all of a sudden she'll just stop talking. So sometimes folks really have trouble keeping the thread going in a conversation. They may struggle with vocabulary. They may substitute a word for something else. So, as it says here, trouble naming a familiar object. So they may say, I want to set the chair versus I want to set the table. Sometimes in normal age relating, we have difficulty remembering things or remembering a word that we want to use. And again, that's normal. At some point, we will think of what that word is. Step 7, misplacing things and losing the ability to retrace steps. Again, here, I always use the example here of misplacing one's car keys. Now, I don't know about you, but I have misplaced my car keys plenty of times. And one of the first things that I do is I try to remember where was the last place that I had my car keys. And I, in essence, retrace my steps. Unfortunately, for a person who may be experiencing some signs of dementia, they're unable to do that backward. I call it kind of a backwards retrace process to see where those car keys are. It's interesting. We're not going to hear from the expert here, but one of the things she describes in the video is that a person with dementia, when they may come in the house, they leave their car keys on the kitchen table, and then, that's not the usual place for the keys, so they misplace them. Eventually, when they see the keys on the table, they think, oh my gosh, how did my keys get here? And, they're out of place. Whereas people with normal aging would say something like, oh yeah, I came in from the grocery. I left my keys on the table, rather than putting them on the key hook. So, we're with normal age related changes, we're typically able to retrace our steps. Number 8, decreased or poor judgment. Again, in working with families, money is an area that families usually have some concerns about. Again, we talked earlier about paying that same bill, 2 or 3 times, or, not being able to, balance the checkbook. Sometimes our seniors are scammed with, giving money away. And it's just really difficult with that area. Also, paying less attention to grooming. I remember working with one family, 2 daughters who were very concerned about their mom. And their first sign that something was wrong with mom, perhaps with her memory or thinking, was that she was a lady who was always dressed to the nines. She never left the house without makeup on. Very meticulous lady as far as her personal grooming. And they remember going to the house. They had not seen her for a few weeks. They live not far away, but they don't live in the same town as their mom. And they went to see her, and they found her in sweatpants, her hair unwashed, unkept, and just in a general state of disarray. And they knew something was wrong, because that definitely was not like their mom. Step 9, a withdrawal from work or social activities. Many times people in the early stages, they realize what's happening to them. They realize that something is not right in their world. And many times one of the first things they do is withdraw, particularly from social activities, from loved ones, from things that they like to do previously. My parents had a very good friends. The husband developed some of these thinking and memory changes. And that's one of the first things that happened to them. He just did not want to be around other people for fear that they would notice what was happening with him. So, sometimes as we get older, we do feel uninterested in family or social engagements, but it's not, we're not making the choice to isolate. And then lastly, changes in mood and personality. And sometimes you begin to see these changes where if you have someone who's been fairly easygoing, or just someone that your parent or a sibling, that, they're just typically they respond to stress or changes in a certain way. And then you notice that they just respond differently. They're more confused, maybe more anxious or fearful. Depression sometimes is very common, and just getting upset more easily. And, as we typically, as we age, some things do make us more irritable. Perhaps when our routine is disrupted, we get into our routines. But, we get irritated, we handle it, we move on. With our folks living with dementia, sometimes that's not as easily changed. So those are the basic 10 warning signs. And when we're looking at what we can do just to help people for the next steps, just want to talk about some of the things that, we can help them with. And, it's really important. And we look at the recap here. One thing that I want to say before I move on, and that is that a person who you notice some of these changes in, they may not have all 10 signs. They may have one sign that you are concerned about. They may have a couple of different signs that you're concerned about, but people don't have to experience them all for there to be a concern. So if you notice one or two of these signs, it's really time to take some action. So I wanted to say that before we move on. So what are the things that you can do? You can help a person. The earlier that we detect that they have Alzheimer's or another dementia, the better. We want to encourage families to get a diagnosis because, as I said earlier, persons will know that they're experiencing some changes. So this gives them some opportunities to participate in their care and future planning. So just want to share some tips with you about some things that you can do to help your loved ones. So just going to real quick, and again, we're working with the number 10. So just some 10 steps to approach memory concerns. You want to start with assessing the situation, having a conversation, and then reaching out for support. So if we go through what changes do you see? Think about that. And we're in the assessment stage. What else is going on? Are there other things that are happening with the person? Are there other big life changes that are happening? Are they selling their home? Just making some transitions. So you have to look, are there other things going on in their life? Learn about the signs and the benefits of an early diagnosis, which you're doing right now, which is important. And also get some validation. Has anyone else noticed the changes? If it's in a parent, has your other parent noticed the changes? Other siblings, families, friends? And then begin to think about having that conversation. And this is a tough conversation to have. So some of the things to think about: who should have the conversation to discuss the concerns? In the family that I was telling you about earlier, the two daughters, and they found their mom in disarray. They started to have the conversation with her, and she didn't want to have any part of it. And I'm sure that some of you as caregivers, you've been in conversations like that, where your person with dementia does not want to hear what you have to say. And she was just not listening to the daughters. So one of the things that we worked on with the daughters was looking at, in mom's life, was there anyone else that she really trusted, anyone else that she really listened to, and maybe bring that person in on the conversation, either with the daughters or just to have the conversation with her in general. So this is a really important thing to think about. Best time and place to have the conversation. We know many times our folks living in the early stages get very tired at the end of the day. That may not be the best time to have one of these conversations. And what will you or the person having a conversation say? It's best to practice. It's best to think ahead. It's best not to do these conversations just on the sly. And then, of course, one of the things you're going to say is, talking about going to the doctor and getting a diagnosis. So offer to go with them so they feel the support. And if you need to, have multiple conversations. Again, with my family that I worked with, we had to have multiple conversations till we were able to convince mom to go to the doctor. And then reaching out for support. I just can't tell you how important it is to reach out for support. And again, circling back to what Sherry shared with you earlier, it's just really, really important to know that you're not alone, that there are other families and folks in the community dealing with these issues. And you can turn to us for information and support. We have lots of ways that we can help you. We provide care consultations to families. We have our support groups, our education programs, and all of these services to the community are free of charge. And again, right now they're virtual, but we're hoping very soon to have these all back, going forward in person in the community. So I'm going to just skip here to the end and just put some resources up for you, because I want to get Deneen on here. She is so great to talk to you. This program typically is an hour, so if you want to learn more about going to the doctor and doing some of those pieces, this is a great program to be in. But also just want to share with you some of our key resources. I never speak in the community without mentioning our 24/7 helpline. You see the number there on the screen. This is a helpline that is available 365 days a year, 24 hours. You can call anytime. You're going to speak to a very trained helpline specialist that if they can't answer your question, they are going to refer you to a master's level clinician to talk you through any questions that you may have. You may just need a resource. Hey, where are the local neurologists in my area? But you may have a borderline crisis situation that you want to talk through. One of my interns, her dad was up in the middle of the night, throwing around his walker and just having kind of a fit. And she and her mom called the helpline, and within 45 minutes, they had dad calmed back down and back down for the night. So it's a very important resource available to everyone. And if there is follow-up that's needed to be done at the local level, they will contact us and we can follow up at the local level with families if needed. We have a great website, alz.org, that has just a plethora of information, resources, education, just about anything that you could possibly imagine. And then our community resource finder is where you would go to find local programs all over in Central Ohio, but just really all over the state and country, depending on where you are at. So I am going to stop sharing my screen here at this point. And I'm back live. So that's an abbreviated 10 warning signs presentation. So we'll have some questions. Deneen is going to present some strategies. And I do see one question here that I'm going to go ahead and answer before Deneen pops on. And the question is, how would you recommend navigating the dignity of an elder that feels lucid and rejects the notion that an appointment should be scheduled just to check things out when you notice one or two symptoms at varying levels? And that is a great question. And I will tell you that we deal with this a lot at the association when we're working with families. And I would just encourage you to continue. If you can't get your loved one to the doctor right away, I would just encourage you to keep talking to them. Keep that communication open. It's really important that we not be overly critical of our folks. And you mentioned the word respect, because as I said, in the early stages, people start out with some mild cognitive impairment and move into the early stage of the disease. They do understand what's happening to them, and it's very fearful, causes a lot of anxiety. And so it's really important for us as family members who are noticing these changes to be very gentle and kind and not and be respectful and not always be nagging them about going to the doctor. But Alzheimer's and dementia, Alzheimer's and other forms of dementia, this is a progressive disease. So if you are noticing these changes and you're pretty sure that they are not just the typical signs of aging, you do need to continue to watch, monitor, and continue to encourage the person to go to the doctor. And that's where you can enlist the help of others. Who else is noticing these changes? Again, not ganging up on your person, but just pointing out kindly that others are seeing these changes as well. And if you can find that person, another person that they really trust and believe in, get them to, help your cause as well. Offer to go to the doctor with them. It's just continuing to encourage and watch. This is a struggle. And Deneen may be able to help you with an answer to that as well. I believe in listening to her story, she may have some tips for you on that as well. But that's a great question because, it's so important when we talk to families about communicating with their loved ones with dementia. It's just so important that you're not critical. I learned early on as a nurse, and as I work at the association and out in the community, that, you're the one that has to change the way you communicate. The person with dementia can't. So great question. Thank you for asking. Deneen may have some additional answers, and we'll be able to have some more questions and have some Q&A time before we're done. So without further ado, I'd love to introduce Deneen Day, a longtime volunteer. She's fabulous, and she'll share with you some effective communication strategies.
So Deneen's camera isn't on yet. I'm not sure if she's listening right now or if she's having some technical difficulties. So do you want to reach out to her? We do have another question, or you and I could talk, because I had a question about the previous question.
Okay, sure. Let me reach out to Deneen, make sure. Is she in the broadcast room, Sherry?
She is. She
Okay.
is. Yeah, just no camera or mic yet.
Okay, so I think she just needs to unmute herself.
Oh, here she is.
Oh, okay, you got her?
Join us, Deneen.
Hello. Just let me in. This is age-related technology problems here, so I'll that. Thank you so much. I am going to attempt to share my screen, so bear with me here.
All right.
Can everyone see that?
Deneen, I'm not seeing. Are you pulling up the presentation?
Yes.
Yeah, I can't see it yet. Once you click the share button, just select the screen that you're wanting to share.
Yeah.
Beautiful.
You got it?
Yes, ma'am.
All righty. Thank you so much, Sherry, for the invitation, and Pam for inviting me to the presentation. Again, my name is Deneen Day. I am a volunteer with the Alzheimer's Association. I'm kind of a hair club member of the association. I not only am a volunteer, but I also am a consumer of the resources at the association. So I'll give you a little bit of background on my caregiving journey. I'm a two-time journey on the caregiving kind of life with Alzheimer's and related dementia. My first tour of duty was with my grandmother. I was a long distance caregiver for her, who passed away from Alzheimer's in a nursing home back in the 90s, where we had limited information about Alzheimer's and related dementias. I became her primary caregiver as far as doctor's appointments, making plans to move her out of her home into a long-term care facility, which at the time was a nursing home. And I became the primary because a part of her disease caused her to be very verbally and physically abusive to my mother. That was my mother's mother. So I had to step in the gap for my mother. For about 2 years, my mother did not see or speak to her mother due to that, the causes of the disease and how my grandmother communicated with her. So that was my first tour. She did pass away from Alzheimer's in a long-term care facility. So speed up in 2003, I adopted a special needs son. And he was the doting grandson to my mother. She was the grandmother that picked him up, took care of him. I was working full time, and he was 2 months old when I adopted him. And so with that being said, they became very close. And then unfortunately, around 2008, I began to see signs of my mother having memory issues. And to speed up, she was first diagnosed with vascular dementia and then with Alzheimer's. So she had a dual diagnosis. She lived by herself. I worked full time. I had care responsibilities with my son. And I also we were navigating her journey as far as diagnosis and what her needs were. So at the time, our first visit with the neuro specialist, he said, you need to reach out to the Alzheimer's Association and find out what resources they have available because you're going to need them. So at that point in time, I did reach out. I became a kind of a over researcher. I overwhelmed myself, and I was very grateful to the Alzheimer's Association to kind of slow me down and point me in the right direction. I joined support groups very early in my mother's journey, and she subsequently lived alone. She then moved in with us. My son became, and I share this, he became a caregiver by default as a child, and many families are dealing with this. So she lived with us. I had to get him to school, get her to daycare, get her some safe in-home care for periods in time. And then she subsequently was moved into a long-term care facility, assisted living facility, because of her care needs. I'm an only child, so her care needs pretty much fell on me, limited family in the area. So with that being said, we've done the whole journey of her living by herself, living with us, living in a long-term care facility. Her journey ended this past July, fortunately in the lockdown situation with COVID. So she had a 12-year journey. And during that time, not only was I caring for her, but I became a community educator with the Alzheimer's Association, a support group facilitator, and then I do advocacy work down at the State House for policy and bills to support not only the people that are on the journey, our loved ones that are on that journey, but also for the caregivers. So with that being said, I intertwine into all of the presentations that I do, my journey along with the journey of other caregivers, and then also what we're finding out by specialists and so forth. As Pam said, this is going to be an abbreviated kind of version of the trainings that we do, or the education series that we do. So I offer you and invite you to join us for the full versions of it. We give multiple community education programs during the week, in the evening, during the day. So please join us so that you can find out more information. So today we're going to talk about effective communication. And hopefully by the end of the program, and I apologize, my program's moving itself, apologize for that. Hopefully we can talk about just the ways that communication changes throughout the stages of the disease. Also, to help kind of decode, we become like an investigator in identifying what we see visually with our loved ones, or family members that we're caring for, but then also verbally what they're saying and how they're saying it, and how we navigate through that. And then also we're going to end with kind of identifying some strategies. And I look at it that our goal is to connect and continue the connection with our loved ones. And that is so very important as they navigate through the stages that they're going to go through with the disease. So when we talk about communication, we've got all these words on this slide, and I always try to infuse this slide with family dynamics. However your family communicated prior to your loved one starting to show signs is kind of how we have to navigate through the disease. So if you have a family that's very loud, uses a lot of hand gestures, there's a lot in the family, you have a lot in the house, that's going to kind of impact how we navigate through the disease and how we navigate through the stages. So all of these words and all of the different ways that we communicate, we kind of have to identify what was their language, what was the love language, how do we communicate as a family before this, and how do we tweak that and look at that, because the goal, once again, is to connect. So when we're talking about communicating through the different changes that occur, we're going to talk about the early stage and how they're still kind of at a high level. My mother was probably at an early stage for a very long time before I had an aha moment. And Pam talked about a little bit. I also had a denial moment of, oh no, because I had already gone through the journey with my grandmother. So the early stages we kind of navigated through. My mother was retired, but she was very involved with social organizations and community service groups. She was active in her sorority. She was active at her church. So she was still very much a part of the community and involvement. So we're going to see some mild things that happen. Then the middle stage, we're going to see more of a use of basic words, not having what I call the adjectives being used as much. We're going to start relying more on the tone and the facial expressions and body. They're going to look at that too, as far as sending and receiving communication. And then we're going to see that we might need to do some scaffolding and undergirding with the emotional connection and identifying what activities we can do to give meaning of life, to give purpose. And that is so important in their journey. And then the late stage, we call the severe stage, is that we're going to start seeing what they're going to respond to, what our loved ones, how they're going to respond back to us. And we're going to really rely on the 5 senses to connect with them. So in the early stages, the difficulty in finding the right words, I call it, we call it a word loss. We might find that it's taking them longer to speak and respond. So as a caregiver, as a family member, as a friend, we're going to have to put on our patient hat and realize that they might have to take time when we ask them a question. They might withdraw from conversations. This is really in my journey with my mother. Her friends start saying, hey, your mom used to engage. They'd be at dinner parties, dinner meetings, her club meetings, but she started to withdraw. And that happens because of taking longer to speak and to respond. That processing slows down. And then, of course, we have where they're going to struggle with decision-making and problem solving. And we're going to see that. It might not be so apparent, but we're going to see that might happen as they start to show those first signs. We're going to have Martha Tierney talk a little bit about what we're seeing in those the first stage or the beginning stage.
Communicating in the early stages of dementia with the person with the disease is important. At that time, you still have language as a tool, so you can learn things about what they might prefer as the disease progresses. For example, as the disease progresses, a person might have difficulty finding words. Caregivers often struggle to know what to do in that moment. Early on in the disease, you can ask. You can say, if you ever have trouble coming up with a word, would you rather that I jump in and give you the word, or do you want me to wait and allow you some time so you can find it on your own?
And she really connected with the asking part. And I think that answers the question that was earlier about the respect. And what we don't want to do is assume that our loved one wants us to complete a sentence or wants us to find the word for them. We want to respect them and ask, especially when we're in mixed company, especially when we're out in public, or we're, at church, or we're at a family reunion, or we're at some type of function. we want to ask them, what do you want me to do? And that's what I did with my mother. How do you want me to intervene? Do you want me to just let you, work through it? Or do you want me to give you the word or complete your thought? So we're going to ask them that. We're going to keep sentences clear and straightforward. I call it KISS. Some people, keep it simple. I say keep it super simple. So we're going to start to kind of work on ourselves to streamline how we communicate. Any of us that have teenagers, raising teenagers, my son is 17 now, we need to give them that information up front in the beginning. If we wait 3 or 4 or 5 paragraphs in, they've lost us, we've lost them, and the communication is obviously hindered by that. So we want to remove adjectives. We want to, use words that have meaning and are giving our thought directly to them. And that's just really important in the communication. Leave plenty of time for those conversations. If we're rushing through, and as I said, I was a sandwich generation working full time. I had to become very, sorry about that. I had to become very efficient, but I also had to give time to allow those conversations to happen. And you want to include them in the conversation because right now in this first stage, we're setting kind of the table or setting the standards of how we move through positively and also to continue the connectivity with communication. So we want to avoid the assumptions. We want to speak directly to them. Really important when we're talking about the respect is to make sure we don't do those things that can disrespect them or they perceive it as disrespect, but also to stop the communication from happening. Find out what is the best way that they want to communicate. I started using Post-its in the house, around the difference in the kitchen, in the bathroom. My mom was not technology savvy at all. So I had to, come up with creative ways. Humor. I cannot tell you how important humor is on this journey and in the communication. My son was just a fabulous ambassador of humor. When he saw my mom was struggling, when he saw I was struggling, he would step in and come up with brilliant ways of turning it into a game, turning it into, I do that too, Grandma. But we need to find the humor because the tears and the fears come often. So laughing together when we can, and staying connected, a huge goal of going through this journey. So in the middle stages, you're going to see, this increase of the difficulty in finding words. You're going to see the repeating. I call it the looping. And these areas here in the middle stage, once again, not so much, we're not going to change their journey like this. We've got to change the way we react and how we process this behavior. And that's really important to come to a place of how we receive the behavior and how we react to the behavior. So they'll invent new words. My son took it as a game. My mom started calling sweaters spoons. So he turned it into a game of identifying what Grandma really needed and what she was talking about. So we, it was levity. We had to turn it into levity and learning what that meant when she started using different words. Losing the train of thought. Once again, that's going to happen. There's going to be a gap. How do you want to move forward with that? Do you want to finish the thought or not? They're going to start speaking less frequently. Excuse me. So there's going to be gaps in conversations. How are you going to react to that? How, do you move forward with that? And then there's going to be more behavior happening and less words. So once again, becoming that investigator of the behavior. But when there is a sudden change that happens, we want to make sure that we consult a doctor. There's going to be declines that happen, but a lot of times with that change, it might be something else going on. Urinary tract infections do come up as a potential for that change happening. And we want to make sure that a doctor can address that. And they do happen in men and women. So I often like to say that, that is an occurrence that happens with both. And once they get the antibiotics, they are better. they go to the next one, which the connecting with them at the middle stage. We want to make sure that we're not doing the scare tactic. Now, my son did it a lot with my mother, his grandmother, but we want to approach from the front. And we want to say their name and say our name, because as it progresses, there's going to potentially be a time when they're not knowing who is in front of them, who is speaking to them. So we want to honor them in giving them that information up front. We want to, if they have mobility issues and they're seated a lot, if they're in a wheelchair, we want to go down to the level that they are, because that standing and sitting dynamic will hinder communication eventually, making that eye contact with them. And the criticizing, correcting, and arguing, huge for me. When my mother started doing behaviors, the first thing that would come out of my mouth was why, or why did you do this? What is it? So we need to work on ourselves again, as far as coming up with responses and picking and choosing our battles. If it's not a safety issue, let them, if they're going to say the sky is blue or this is going on. My mother started confusing winter and summer, and whether it was snowing or whether it wasn't snowing, so forth. If it's not a safety issue, meet them where they are and can encourage the communication. Once we start correcting, once we start criticizing, we're going to start hindering their willingness to continue to communicate with us. And they'll start also identifying body language and tone. So we want to work on our tone. We want to work on our body language, and then taking our time with our communication with them. So when we're talking about when I say meet them where they are, they have a reality that they're in. So we've got to meet them where they are in that middle stage. And there's no time frame. I'll add, there's no set time that someone's in the first stage, the middle stage, or the late stages. Everybody's journey is different. If 50 people have been diagnosed with it, you're going to have 50 different time frames that they're in. Some of these stages overlap. Some of them they're in quicker, and then they advance to the next stage faster. So just know that these there's no set timeline regarding this. But we're going to start to have to identify things and how to show empathy and respect and assess their needs. They were not necessarily going to be able to tell us. We're going to have to always start out with that we hear you, and that we hear their concerns, even though it might not be accurate. It's their reality. But we're going to give them an answer, respect them to give them an answer. And this is when we work on ourselves, that, yes, Mom, I understand. Try to assess what emotion is behind it. My mother she had a favorite sweater. When it was cool, I was always trying to put it on her, and suggest that she put it on. She was refusing. And I was like, what's going on? Why don't, it's cool. I know you're cold. It turned out there were seams and tags that were irritating her. She couldn't verbalize it, but instead it was a behavior of refusing to put it on. So we're looking at what's behind the emotion of what they're doing and what they're not doing, and what they're saying and what they're not saying. Really, really important in that manner. We're going to shorten the sentences and use basic words, take away the adjectives. Going back to if we were going out, oh, Mom, I think it's going to be cold today. They said the temperature is only going to be 30 degrees, 40 degrees. And shoot, they said it might even snow. So let's put on, why don't we, do you think you need a coat? No, Mom, it's going to be cold. Here, let's put on our coat. And I'm going to put on my coat. And then that's going to give her a visual that we're putting on our coats and we're leaving. All of that other adjectives and other information confuses her or your loved one receiving the information. We're going to speak slowly and clearly, and not add on a bunch of questions. We're going to ask one question at a time, give them time to process. We're going to limit distractions, TVs, radios, music playing, other people in the room that might be distracting them. If we really have a question that we want to answer, that we need answered, we want to reduce those distractions so that we don't block the communication. And once again, being patient. And then if they've agreed, my mother agreed, give me the word. My son would give her the word that she was looking for, to offer, but make sure that we're still being empathetic and sympathetic to what they want and how they want their journey to go. Control in the journey as much as they can is so very important for our loved ones, because they already know they're losing the ability to do some of the things that they did without even thinking before. So we want to continue the respect and the dignity on their journey. So we're going to talk about using visual cues and gestures. My mother would go into the bathroom. She wouldn't know why she went in there. So I put Post-its up, are you washing your hands, wash your face, brush your teeth? Are you going to use the restroom? Those are cues, so that when she went in there, but it was when she was at home by herself, because I was working, I would put on the refrigerator, your lunch is on the, second shelf, and this is what it is. You might start to give them a list. Put your answers into questions. So for example, for lunch, instead of saying, Mom, what do you want for lunch? Do you want, a turkey sandwich? Do you want this leftover Alfredo? Do you want the soup? We're going to put, hey, Mom, we're going to have, lunch. For lunch, we're going to have soup. I think I'm going to have soup for lunch, because then it reduces that processing time and that frustration that they have. And you might have to repeat. As Pam said earlier, that looping that happens, that repeating question. I had 3 clocks and 2 calendars in my mom's room at her long-term care facility. But inevitably, she would ask me what time it is, because they lose the ability to understand the clock is going to give them the answer. If she wanted to know when she was going to lunch with her friends, even though it was on the calendar, she lost the ability of understanding that the calendar was going to give her the answer. So we've got to, not only potentially give visuals, but we might have to give verbals and also help them navigate those questions that they have. And we're going to try our best to turn a negative into a positive, distract them away from the negative and distract them away from things that are going to cause them to be more frustrated, and avoid, as I said earlier, the whys. Remove why from your vocabulary, because they're not normally going to be able to answer why. And once again, we're joining them in their reality. We're going to reassure them as much as we can, to reassure them, because we want to continue the connection and focus on what they're feeling, not necessarily the facts, because the reality might not be factual, but it is their reality. And we're going to validate their feelings, but then also try to redirect to something else. So when we talk about the late stages, and every family, every journey is different when the late stages come and the decline comes to the late stages, but we've got to become even more diligent in our understanding of our loved ones' love language, what they enjoyed, what they liked, what did they gravitate before they hit the late stages. So very important. And figure out what words they've been using. So when we go back to that family dynamic, what are words that they've been using forever? And, spouses have their own little communication. If it's a parent-child relationship, what were some of the words and things they did that they're familiar with? We have to pay more attention for pain and identifying pain, because they might not be able to verbalize it. We want to make sure that we're doing everything we can to keep them feeling safe, to keep that connectivity, and that they feel safe with you or whoever they're with. And then we also want to continue a respectful conversation. We want to continue, as long as we can, them talking. So we want to do things that they enjoy. And we're going to use the 5 senses to communicate. We're going to increase our knowledge of what those 5 senses are. And then we're also going to increase our knowledge of what of the 5 senses has been a connective communication with them. So the first one is going to be the connecting through touch. Huge with are loved ones that potentially are not going to be able to initiate touch. So we want to be able to initiate that touch. We want to be able to identify what are some of the things they enjoyed with the touch. My mother, her hands were always cold. She said my hands were like heaters to her. She also always thought her hands were dry. So when she transitioned into the late stages, I always showed up at the facility. I was there every day, and I had some fragrance lotion in my pocket. She started to automatically just put her hands out, because she knew that the first thing we were going to do is I was going to put lotions on her hands. I was going to warm up her hands, have them soft, and then also another sense that we're going to talk about, smell. So we had a twofer there. We had smell and touch in one. So that was a part for us to have positive communication with each other, a positive interaction. She enjoyed it. She began to expect it. Even when she did not know who I was, she remembered that I was going to come in and I was going to have lotion, and we were going to have experience that positive connectivity. Therapy dogs are huge now. They're taking them into long-term facilities now. If your loved one or, the person that's on this journey has a pet, we are trying desperately to keep that pet with them, because we know the touch and the nearness of that pet and that animal is therapeutic for them, and it also is a way of communicating with them. But we want to continue that connectivity with them. The next one is sight. Whatever they visually enjoyed, whether it was watching movies, whether it was watching birds, having bird feeders outside in the backyard or in a courtyard, it's really important to continue that if they enjoy that. Having photo albums of family, having pictures hanging up in their room or in their home, continuing that. If they enjoyed, watching National Geographic and watching animal shows, to have that available so that sight is still there. If they enjoy painting, I care for my uncle. He enjoys coloring. If they enjoy that activity and sight is involved, we want to continue to encourage that and continue to make that available to them. Sound, as I said, you might have a sound where, if they enjoy musicals, my mother started watching Westerns. I don't know where it came from, but she enjoyed watching Westerns. So there was this whole site, there were sounds of what was going on with the Westerns. But if they enjoy music, continue to play that music. Live music is awesome for our loved one. If they enjoy music, and we can still take them to live once we open back up, and have that available. Live music is huge. If they played music, if they played instruments, have that available to them, even though they might not be able, if they were a guitar player and they're not just the strumming of a guitar, and they can feel the vibration of the guitar on their lap or in their hands and their arms. Reading books, if they no longer can read themselves, but read and bring magazines that they enjoyed. You'll have pictures, reading gives that sound input, but make sure that you're also acknowledging the tone that's involved with that. Then we go to smell. Huge is part of the love language of smell, that it involves food, the love language of the spices that they love or the food that they love. If they were a coffee drinker, if they're they tea, to have that a part of where they can smell that, and see it and taste it, all of those things. That is huge, because it continues the connectivity, and it continues to give them, a happy time, pleasure on this journey. So to use those items. And of course, taste. And I always interject at this point in time, our loved ones, when they're, in the last stage, I call their Mediterranean diet, whatever they will eat. And there's just, a high probability that they might eat a lot of chocolate, a lot of candy, a lot of cake, the popsicles, the shakes, the smoothies, because their taste buds do change. And that signal to the brain, they might need that chocolate to signal that they're eating something that's good. So through taste, we invite them to communicate, offering that. The other thing I had in my pocket when I went to see my mom was Werther's. She loved Werther's the little candies. She also knew that I was going to have that in my pocket. So she held out her hand to get that candy. Tootsie Rolls. Love Tootsie Rolls. Tootsie Pops. She loved those. So that was a way to connect positively with her, because it was giving her a taste. It was also giving her something that was from me. I got positive endorphins by giving that to her, because I saw my mother in late stage when she had stopped speaking, when she was really limited in what she could do. But I was able for both of us to have a communication that was positive, and that was so important. So in all these stages, the most important is to meet them where they are and to connect with them at the stage that they're at. And the acceptance, especially if you're a full-time caregiver or you're, a family member that's on this care journey with them, is to, accept that that's the disease. It is not them. So their reaction and their behavior, it's not them, it's the disease. And then to also to make sure that we, as best we can, to retain, how they are and what they can do as long as possible, and to keep the respect, and to keep learning how we can decode what they're saying by their body language, by the words that they're using, even though the words don't make sense. And then recognize how you present yourself, your body language, your tone, the words you use, refraining from using frustration words. Oh, you make me so mad. Why do you do that? What's going on with you? Why can't you tell me what you want? So learning how we can remove those words from our vocabulary and to remove that way of communicating with them. And then understand why they're sometimes reacting. What happened prior to the reaction or their behavior? And then making sure that all of the things that we're using to connect with them, that we are de-escalating and that we're calming them, that we're not escalating the communication and escalating their behavior. Dr. Fazio is going to talk a little bit about caregiver stress and how we need to be a caregiver to ourselves on this journey.
Taking care of yourself while you care for somebody with disease not only impacts your own health, but it really can impact the person with the disease. So, for example, if you're not getting enough sleep, you might be easily irritated, which will then sort of spill over to your interactions with the person with the disease and maybe being short with them, which then might cause them to get frustrated. So it's not only important to take care of yourself for your own health, but really for you to really be a good caregiver.
And I'm going to, the information here, Pam talked about a little bit about this information, but please reach out. I can't tell you, and Sherry's, thank you so much for sharing your journey as far as with support groups. For the 12 years that I was on the journey with my mother, I was a member, sometimes 2 different support groups. I'm a huge proponent of the support groups. I believe being in safe and brave places to share your journey with others that are on the journey is so very important, because we tend to isolate ourselves. We tend to believe that we're the only one that is on this journey, and it is refreshing. And the tears and fears and cheers that happen in support groups is so vitally important on the journey, because our journey with our loved ones is typically not a sprint. A person can live a very long time and be in various stages of the disease. So reaching out to all of the resources that are on the screen here through the Alzheimer's Association is so very, very important. And I'm going to end, I believe we're going to have a question and answer period right now. So I am going to stop sharing and go back. And I see Pam's there. So please, I believe we're open to questions.
Deneen, you are awesome. Thank you so much for sharing. You're just great. So I talked a little bit about earlier the question about navigating the dignity of your elder that maybe rejects, your suggestions to go see the doctor. Any tips that you found, with your mom or your grandma that you found helpful to add to what I had said earlier and shared?
Sure. I think with the doctor visit, there's denial with everyone. And if you can incorporate it somehow away from their going to the doctor for the diagnosis, the disease, and more of just health. I'm going to the doctor for health. We're going to the doctor for health. Everybody, the more you focus on you're going because we need to find out what's wrong with you and we need to find out if it's Alzheimer's, that becomes more of a deterrent from them wanting to go to the doctor. So I think the phraseology that we use, the words that we use, and not putting it on them, it's a we, and we are doing this, I think the better results. But a lot of families go through multiple conversations about going to the doctor. Mm-hmm. And so it's not sometimes going to be the first conversation they're going to want to go to the doctor.
Yeah, agreed. I think we see that a lot. We have another question in the chat. Have you found ways to help overcome a generation that, for historical reasons, has been largely distrustful of the medical community for Black patients? Though this has been going on for a while, this is still a contemporary issue, particularly since it's clear that early detection is important. So, Deneen, I'd love to hear your thoughts on that. I'll just share very quickly for our viewers that health equity, diversity and inclusion is actually a pillar of the values of the Alzheimer's Association. And we are spending and investing in working with and integrating with our diverse communities to find out resources that are needed, if education and support groups are needed, just what kind of help is needed in our diverse communities. And we're starting out listening. We want to hear from you because that really helps us shape and inform our policies as we're moving forward. And we have a lot of stigma and distrust and a lot of things to work through, I think. What are your thoughts on that, Deneen?
Absolutely. Thank you so much for the question. And thank you, Pam. I believe that we do have some hurdles in regards to going to and trusting. And what I say to the community, and once again, my grandmother was in the 90s. There was very limited, and we didn't understand the impact in the communities back then because there wasn't a lot of studies going on. But emphasizing healthy lifestyles, as I said earlier, my mother had vascular dementia. High blood pressure and high cholesterol were the underlying issues with that. So when we talk about kind of lifestyle, eating habits, and so forth, we're having an engagement and talking about that with not even having the medical provider involved in it. So that's how we can start stepping into this, is just talking about vascular dementia is impacting our communities at a very high rate. But talking about the shift in understanding that with the high blood pressure and with high cholesterol, we're at a very high rate of having vascular dementia. So talking about those things first and talking about, well, if we are in a category of having the symptoms of it, then we need to go, because if we don't get that intervention, if we don't get that, then we're going to potentially be looking at having to treat the dementia and not only the high blood pressure, not only the high cholesterol, but also the dementia. And having a trust in the community of medical providers. And Pam and I have talked at length about this, of having specialists that look like us, that are part of, and understand. And that's what we're moving towards, is having community representation, not only on different education, but also in the medical, in the practitioners, the primary care physicians. Is so important that when they are talking to their patients, they're talking about this, that they understand that it's impacting it, and being a part of that conversation and being at the table. And there is an initiative. We have an initiative with the AME Church that we're working on. We're doing, and I've done initiatives and educational programs with churches to talk about. All of our churches have health ministries. We have wellness ministries, to talk there so that we can start to have trust with the medical community, so that we don't end up being at that late stage, mid stage, and we could have kind of navigated earlier by going to providers. So I hope that helps.
Oh, absolutely, Deneen. You are absolutely right. So this question just popped up, and that's the question that we've been addressing. And we've had, Deneen's right. We've talked a lot about this, that, it's having the caregivers, the professionals, the medical professionals, like you said, that look like you and are hopefully understanding those issues that are coming in from those families. So that's so important. And we're just committed at the Alzheimer's Association to listen and to connect and provide those resources for our families. So I see Sherry popping in. Uh-oh, can't hear you.
You're muted. There you go.
It's so funny. My career is in technology. Do not laugh at me, but I did this all day yesterday. I should know better. I am not technology challenged. It's bad. But I just wanted to thank you. You guys are amazing. I've learned a lot today. And I've been dealing with this for a while. And Deneen, it's interesting that diagnosis of vascular dementia, that's what I'm dealing with my mother. So, it was heart disease, and basically the way they described it to me, well, you've got clogged arteries down here and clogged arteries up here.
Yes.
So, it's been a long time, but I think just in the past year, it's been the most challenging.
Yeah.
And it just seems to be, at an exacerbated rate now, that I never know what I'm going to get in the morning.
Right.
Or if I'm going to sleep during the night.
Exactly. Yes. And that's so very important. All of them have different trajectories, but the decline in a vascular dementia setting, it might be because of the mini strokes. So when I say mini strokes, MINI strokes.
Mm-hmm.
But when they start doing that swing in behavior, and they're up at night, they might be watching TV, packing things, shuttling things around. Yeah. But as you said, which is a huge important issue, is caregiver stress and not getting sleep.
Yeah.
Sleep in the caregiving journey causes us to sometimes mimic our loved ones' symptoms, because our brain, restorative sleep clears the plaque and tangles. When we as caregivers don't get restorative sleep, we're damaging our brains. So we have to figure out what that is. And so as a caregiver plan of what that looks like, and respite, and getting that care team together, it might be to help you get sleep. The reason my mother had to be placed in a long-term care facility is I became very, very chronically ill, and my body started breaking down because I wasn't getting restorative sleep and I was working. So that is a huge component, and especially in our communities where we already have added stress.
Yeah.
It's so important to identify that sleep and eating, we have to get the respite to do both of those, and to be very diligent and intentional with getting the sleep and eating. Because when we don't, it's a gradual buildup, and then all of a sudden your body falls apart. And
Right.
when we have to go, I had to have surgeries. When I had to have surgeries because my body had broken down, I had to get care for my son and my mom. So you're already added more stress because now you have to get care for the ones that you were caring for. So you're adding stress to that. So you brought up thank you so much for bringing that up. Sleep is one of the number one reasons why caregivers break down.
Yeah, I really have to work on that. Before you both leave, I want you to meet Miss Ella Coleman. And she just joined us. So I'm going to bring her up. One moment. There she is.
And how are you, ladies? I have
So
thoroughly
near and dear to
enjoyed
my heart.
hearing this information because I took care of my dear sweet mother for 10 years. She passed in 2019, and I was always very, very close to my mother, and I'm an only child, so I took care of her pretty much, myself. Learned the system as I went because I've been in business for years. Didn't know nothing about nothing, how to access anything, so it was just kind of just try whatever you can. But through that, I can say that I'm a better person today because when you you give so much of yourself that is, I believe, where we all should be in helping others. But that really was an experience, and all the things that you talked about were things that I experienced. The no sleep, the different phases of it over the 10 years, with it starting out just, with the repeated speech and then getting to the point where they can not feed themselves or anything. This is important to know so that you can be with them on the journey. And so love is definitely the key factor. And Sherry, you know that because you're in the process of taking care of your mother, your sweet mother, whom I know very well. And I can just say, whoever goes on that journey, you will not be sorry that you gave of yourself to keep the dignity. I think what I fought for more than anything else was the dignity. So I just want to thank you, ladies, for sharing this vital information, because as we all age, we are dealing with these kinds of issues. And if you know nothing, like I did know hardly nothing, I know that my mother took care of her mother. I know that my grandmother took care of her sister. I knew that this was something that was a traditional line of, what we did in our family. We didn't let a family member go to a nursing home. And I refused to let my mother go into a nursing home because I wanted to make sure that she was taken care of. And I fought for her. So it's a battle because you have to fight for the people that you love. You have to fight for what's right for them, not what's
I
right
think
for us.
that's what it's, yeah, I think
Okay, I'm
that's what
done.
it's
I'm
about
done.
for that's what it's about for me too, is the dignity. For my dad, I cared for him all the way through. With my mom now, I'm fighting for that. But Janine, I definitely heard what you said about why, you obviously were trying to care for your mom, but then when you became critically ill, you had no choice. And that's what's scary for me is that I know I have to take care of myself. I know that I have to because, and so I'm so backwards in my thinking. I think I'm not putting myself and my health first right now for me. I'm doing it because I'm thinking I can't get sick. I can't get sick. I have to care for my mother. If I get sick, if I'm injured, I'm hurt. I can't care for her. What's going to happen to her? And that's really in the front of my mind. I've been, exercising. I was already vegan, but you can be an unhealthy vegan. And so I've been focusing more on making sure that I'm like a 90% healthy vegan. And every once in a while, I'll have, a little unhealthy food. But one of the things I struggle with, and I don't know if either of you can answer this, Pam, I may have asked you this before in our conversation, but um, if you're living near or below the poverty line, if your loved one is on Medicaid, it seems like to me there are a lot of resources available, right? Obviously, if you're wealthy, yeah, but you can get whatever you need. But for those of us that are in the middle, you mentioned respite. I don't get respite. I haven't had respite in 2 years.
Right.
And so if I want to go on vacation, right, I have to not only save, a couple $1,000s, whatever we're going to spend just to be on vacation. I have to save like $3,000 for care.
Right.
So, and the care usually exceeds whatever I would spend if I go on vacation. And so, it's not often that I can do that. And now since COVID, I mean that's what it pushed me out to 2 years. Um, so my question is, well, Deneen, I want to join you in fighting in the fighting for policy and advocating for policy.
Right.
But I feel like there's nothing for people in the middle. We still need a break.
What I'll offer, Sherry, to you is my mother was a retired state teacher, so she had a
mama's teacher.
So she was in that category.
Mm-hmm.
The advocacy work that I did for my mom, there is respite money available. So the senior options in Franklin County, and I don't know where you are, but counties that have senior levies, there's monies available. So through senior options, I received respite money for my mother. She lived with us. So if you're a full-time caregiver, they live with you.
Yeah.
There are, because they recognize what's going on. There's also, so Passport is another, senior options is another. There are some, and even if you don't meet the income, you're not low enough income wise, they sliding scale. So when my mother went to daycare, when my mother needed transportation, which didn't work out too well, but those things, they did a sliding scale.
Okay.
So you're not paying
full price.
So those are the resources I would reach out to. And then also I'm pretty sure, and I don't know if Pam and you talked about it, what I did is I would tell my story to whoever, and then have them find out where we fit in. What our family situation. So for me, I wanted to check out long-term care facilities because I knew I wouldn't be able to take care of my son and my mom to the best of my ability. So I used my respite week. I got a week of respite every year. I put my mom in respite care in facilities to check them out, to see, how they function, what was going on. And so by the time I placed my mom, I was really, really familiar with the number of long-term care facilities here in the Columbus area. So check into that and always ask. All they can tell you is no. And you say, we can't, and then I also, being an only child, I had a village of really close friends. And one of them, her lane was very clear. She would come and stay with my mom. I didn't ask her anything else the rest of the year, but I said, can you stay with my mom for me to go? And she was gracious enough, loved my mother. And that's all I asked her. So I had lane friends in their lane. They did their lane really well. So you want to start making sure you get that village, that squad, that posse, because if you don't, and they were the ones that said you no longer can take care of your mom. They saw me that I was crashing and burning. I was crashing and burning at work. I was crashing and burning with my son, and my son became very impacted by being a caregiver. And I will say to those on this, sandwich generation caregivers is going to be, because we're starting to see people get diagnosed
earlier. Yeah.
The early onset. These are individuals in their 40s who have young children, a spouse, they're still working. So we've got to wrap our mind around that as to what we do and how as a village, and especially communities of color, of how we become that village again. And reach out and help those families that are in because if there's a diagnosis at 40 and there's no medical impact, they can live a very long time in these different stages.
And that's a
So
lot.
the village means checking on that family that you know has a diagnosis, making sure you know what their plan is if they wander, going to the grocery store, giving a break, even if it's a half an hour. I know a lot of caregivers, when somebody comes over to help for a half an hour, an hour, they go and sleep. They don't even go anywhere. They just, I mean, they do
Right.
they do uninterrupted. They watch their show. If they have a show they want to watch, they watch their show.
Go
So
lay down. How about go lay down?
I'm gonna lay down. So we've got to be, our community has to be very intentional with being the village that's not a paid village, because monies are not available. So I offer that. I'm going to have to jump off. I thank you all so much for the opportunity. Please reach out to the association. I'm, I'm retired now. And my journey with my mother just ended in July, but I am a huge heart for all of the caregivers that are out there right now. And so I'm available. Pam knows I'm available. So if I can be helpful to anyone out there, please contact us. Pam has my information. So thank you so much. Thank you so much for the expo.
Thank you
So much for the invitation.
Thank you, Denise. Love you. Thank you.
Bye-bye.
She's just awesome. We're so
I'm definitely going to link up with her, so I'll get with you about that.
She is she's been volunteering for the Alzheimer's Association for the past 12 years. Wow. So in addition to all the things that she described this morning that she did, grandma, son, mom, she volunteered as well. No. And she does work. We have different volunteer opportunities for folks, and she's been instrumental in delivering our education programs like this morning in the community, but also working on the public policy and advocacy side of, and that's been, so important. And Sherry, just to follow up to your question, our care consultation services at the Alzheimer's Association, that's what we would do. We would link you up with senior options or resources in, the county where you live to try to access some of those services that Deneen just described. So, that's one of the things that we would do during that process. So, yeah.
I'll have to check back in with them in my particular case. Maybe things have changed. It's been a few years since I checked in. So, I'll do that. This is an interesting question, and I have to just shout out to Simeon and thank him he's been giving us amazing questions this whole thing. So he says, whether in real time or on demand, eventually a man in this situation will experience this content.
Yes.
In a panel of 4 women, what advice would you give a man that loves his parents or elders, but may not feel as though he's naturally inclined to be a caregiver, but finds himself in that position for any number of reasons: geographical convenience, only child, most financially stable, etc.? That's a great question.
Well, I'll just say that Deneen talked a lot about that before she jumped off, informing that village. If there's lots of options, keeping folks at home as long as you can, doing some placement. I mean, there's lots of options for care. And, we spend, women have Alzheimer's and dementia. If you look at a pie, we have it 2/3, and men have dementia 1/3 of the time. Wow. So there are a lot of men out there who are primary caregivers. So Simeon, let me just say that lots of men out there. And I think that, again, each situation is individual and unique. And, there are a lot of folks, there are women included, who are not what I would say more like a natural caregiver. That's just not their bent. And so, there are another way many times through our care consultation process and working with our families, we talk about, ways to look for good placement. What are some tips in looking for placement? Where do you look? Do you have a case manager? A lot of it's financial. There are agencies out there that help you find placement. I mean, there's a whole machine available if you're looking for placement. if you prefer to keep your loved one with you in home, maybe not your home, but their home, you know, there's options for in-home care and respite, as we talked about earlier with Sherry's question. So it's a very unique situation. We're all unique humans, and the way the disease affects, it's different in everyone, and it's different for the caregivers. So it's really finding out what works for you, what works for your person. And, you know, so many times we deal with families and they'll say, we promised mom, we promised dad, I promised my wife I would never put her in a nursing home. And, you know, we try to assure them that, as Deneen experienced, her health deteriorated. She really had no choice to keep her mom safe, to keep her son safe, and to keep herself healthy, to be able to take care of all of them. And so, you know, sometimes as people progress in the disease, they forget that promise, and you're really doing more benefit for them if you have to turn to a placement. And I will say, one of our staff that works at our office, she took care of her mom, like Deneen, up until the point where she just literally could not. And her mom was a wanderer, so she got out of the house, despite having alarms and locks and, you know, all the fancy gadgets, just constantly not a safety concern. So found placement, and mom ended passed from there, but was there for about a year. And I always will remember our staff person sharing, you know what, that last year was really good because I got to be the daughter again instead of the caregiver who was always, you got to take a shower, you got to eat, you got to stay here, you got to do this, you know, that, you know, pressure. So
Yeah.
Simeon, I would just say that, you know, talk to someone about your options, build your village. There are different men's support groups. So there are places you can go to talk to other men who are experiencing what you're experiencing. And so I'm sure Ella has, I'll shut up and let Ella talk.
Well, you're the expert, and I, you know, went through the experience, and I'm always praying for Sherry because I know what it's like. But I think reaching out a little bit more, you know, just there are people who will. I mean, I remember a person that just loved my mother. She was a part of a daycare team. She drove for the daycare team. Mom went for 2 or 3 days a week at one point in time. And she just loved my mother, and she just bent over backwards to help. And so you got those kind of stories. And when mom passed, she was right there. There were people who just loved my mother, you know. But I think, you know, just remaining open to there are people who really like to work with older people. I met a young person who was 25 and she just loved older people. And I was like, you do? And she said, oh, I just love your mother. And I, you know, and so, you know, that was a part of the good experience. And then you have other experiences, but you know, you're advocating for your parent, but, you know, you're also very protective. But I think you have to, you come to some plateau where you realize you can't do it all yourself. And, you know, I'm here for you too. I know I haven't helped that much, but just for prayer and stuff, but, you know, just kind of open up a little bit so that it's not all on you. And I think I had to do it. I was doing 7 days a week, 24 hours a day. And then I said, I know I can't keep doing this. And then I reached out to a daycare, Isabel Ridgeway daycare. And I went over there, and do you know, I went over to Isabel Ridgeway at the time. I think they've changed it to something else now. I went over to Isabel Ridgeway because I was so tired and I was doing it 24/7. And I realized, I mean, I was like, I love my mother and I don't care what I got to do. But it was wearing me out. And I said, I've got to do something. I can't keep going like this. I know I can't. And so I went over to Isabel Ridgeway. I called some places. On the second call, when I called Isabel Ridgeway, they said, you know what? Come in, because we just got a grant for people with dementia and Alzheimer's. And we have a special program that we're putting together. And that program got me over the hump. And there were people there that were specializing. They were, gerontologists, and they were this and they were that. And they took them on field trips. And because my mom could still walk and do all that kind of stuff, it was just more mental, and so that took me to another plateau. And then I had to deal with something else. When they closed, I had to deal with something else. But I found out it was just through trial and error. But I don't want you to have to go through trial and error. Sherry.
Right. I think there's a tough situation too. If you're caring for a loved one that needs help with personal care, and then there's a trust issue, like, oh no, they can't. That's difficult. Um, and I may reach a time where I have to, like you said, get breaks through, daycare or something where, like you're just gonna have to trust them.
Just for 3 hours or
trust
something.
them. Yeah.
Just for 3 hours or something. And then they bring them back, a half a day, twice a week. At first, they said, we can put her in 5 days a week. I said, oh, no. Oh, my God. I said, she can come 2 days, but I can't even see her coming. I mean, here I am saying, and I was thinking to myself, afterwards, I thought, why can't she go 5 days? But it was like, oh, my God, I was so protective over my mom. I was just like, no, we can't do 5 days. We can do 2 days, maybe, a half a day, because I just didn't trust nothing or nobody. So
Mhm.
I had to get over that, because they were really good people over there. And they had a very, I think it was just an excellent program where they kept them, mom would come, there were things she was making and she'd bring it home. And, I was just so proud and stuff at that point in time, and I was like, yeah, they said, yeah, and Miss Ira's doing this and Miss Ira's doing that. And she loved them over there, and so it could be the same, with your mom, because I know your mom. I know she's strong. I know she's
Mhm.
a very dignified woman, and she's
Yeah.
a very educated woman, so it's hard.
Mhm.
And my mother would tell me off, and stuff. So, I was kind of scared about some stuff, because mom was always the authoritarian. and,
Right. That's
and,
the
and one
other.
time she said to me, I'm the mother and you're the daughter, and just get that straight right now,
Well, my mom calls me mommy all the time, but she's being facetious. But yeah, I mean
Right.
I think that's the other challenge too, is when you're a child, it's not a spouse, but it's a child, and you're like, okay, how much do I take control here because I'm the child and all that.
Right.
That's got to be a conversation for another day. I just
Another
looked at
time.
the time. It's 11, so and we have another workshop coming up in about an hour. So we're going to take a break. I hope you, both of you, have time, can jump on and watch that. If not, it'll be recorded. You can watch it later. But Pam, thank you, thank you, thank you. We'll definitely be in touch. The expo, we definitely want to do more throughout the year on this topic. So thank you for your time today
You
and the
are
information
welcome.
and bringing Deneen. And Miss
Yeah.
Ella,
Yeah.
I love you. Thank you for jumping in here. I just knew that your experience with your mom would be, just hearing your story would probably help some people. And I'm happy to see you crying. I mean, smiling and not crying. I know how close you were with your mom. And, that's an interesting thing. I cared for my dad. It was grueling for 5 years.
Mhm.
And some people on the outside might think, oh, well, at least you can get some rest now. And it's like, no, no, that's, no matter how hard it is to be a
Yeah.
caregiver,
You
it
love them.
doesn't change the grief.
Mhm.
Yeah, it doesn't change the
Mm-mm.
grief. So thank
No,
you
you
for
still
sharing
love
your
them, and you miss
story.
them. Mhm.
Yeah, yeah.
Yeah.
Thank you so much. All right. Well,
Mhm.
thank you to everyone. I do want to share, we have more events coming up, again, health and wellness this afternoon. We have an HBCU college fair in the morning, Saturday morning, and then our Black Excellence webcast In the afternoon, we'll have our OBE honors. We'll have some entertainment. We'll have Veterans Memorial. We'll be honoring veterans and also honoring high school and college grads, and lots of other great things. So we hope to see you for the rest of the expo, and save the date for next year, which will be Memorial Day weekend. We'll be downtown on the riverfront. We want you to come out and celebrate with us. And I'm going to play a couple promos for you. We're also partners with the Classic for Columbus, which is coming back. They're coming back. They've been gone for over 2 decades, just like us. It's coming back. It'll be in August. So I'm going to play those 2 videos, and everybody enjoy your day.
All right.
you.
Thanks. Bye, Pam.
Bye-bye.
Nice meeting you.
Nice meeting you.
Bye-bye.